Good afternoon, Palm Coast. We're here today at our virtual City Hall that has been closed for COVID-19 for some time now. We continue to work and deliver services that have been undisrupted as we go through this unprecedented time. It's our understanding that the governor of Florida is currently working through a plan to reopen the state of Florida. We actually have been watching this. We have been following this. We're in constant communication not only with the state, the other agencies, our partners, and so our leadership, our executive team, has taken the time, as we promised after our virtual town hall meeting on Wednesday, that this week our residents will get to see and what to expect in this reopening process. Now, I will stress the fact that when we talk about this, you're not going to see dates on this rollout, and there's a reason for that the chief will go over and why this is so important. But this does not change the fact that we are going through an extraordinarily serious global pandemic. It's not changed the fact that we have to be mindful of our residents, our neighbors, that could possibly be transmitting this virus. So with that, I'm going to turn it over to our city manager, Matt Morton, talk a little bit about the approach, how you came to this point, and what you feel, and then we'll turn it over to our fire chief.
Absolutely. Thank you, Mayor.
Thank you.
So thank you again for joining us this afternoon, and we did mention we're working on this document. The best way I can describe it to our residents at home at this moment is it's a map, and our guidance criteria that you'll see appended to this, and both of these will be posted in our virtual City Hall on Palm Coast Connect. But our guidance criteria is our compass, and the reason is that we have a lot of terrain ahead of us. To your point, Mayor, this is unprecedented. It's never happened before. There wasn't a plan or a book that we could pull off the shelf. We ultimately know what our destination is. And that is all of us in America want to see our country fully reopened. We want to be back to business. We want to return to the new normal, as everyone's calling it. Right? So knowing the criteria of how we do that and how we do that methodically, again, how we do that with not with fear but with courage, how we do that with good decision making, is what we've laid out in what we're calling our phase-to-phase gate criteria opening plan. And so this is a strategic framework really geared at helping our staff, our local leaders, our council, our community understand the different metrics that we need to reach in order to begin moving through the opening stages of, again, getting to that ultimate goal that we all want to get to at some point when it's right, when it's appropriate, of opening and the new normal. So
Matt, would you say, though, the process started really with some different levels of assumptions, correct? Like, again, because this is so unknown and because this is so fluid, that this map, right, this approach that you've taken and led has been really one based on a tremendous amount of assumptions that are still possibly very much unknown.
Absolutely. There's a lot of assumptions. They're good assumptions, but they do change, as we've seen throughout this pandemic. There are assumptions based off recommendations from our state leaders, from the Centers for Disease Control, from the various institutes of health that have been studying and providing us guidance and data on this pandemic, from the Florida Health Department. They still remain assumptions, and so we take those assumptions and we will continue to monitor and respond to those changes in assumptions and changes in direction as time goes on. But as we sit here today on April 24th, this is the most current set of assumptions we have and the best information we have to begin working towards, again, a very rational, strategic, and we believe meaningful approach to reopening our community.
Thank you. And Chief Forte, you have obviously have many years in experiences, not only dealing with crisis management and wildfires and hurricanes and everything that you can possibly be thrown at you as far as emergency management, but this is one that obviously is one we've never seen in our lifetime. So, I really want to say we appreciate the approach of the Palm Coast Fire Department in partnership with the County Emergency Management Department and the other stakeholders that have been instrumental in continuing to provide us meaningful, helpful guidance as we go through this, but these are unprecedented times.
How do you plan for something that's never happened before? And that's the approach that we took as a team at the fire station when Deputy Chief Clark, Chief Berryhill, and Captain Asconi met to discuss the main topics of these. And the only thing that we have is you have to be flexible. You have to be able to take the information and interpret it. And you have to have a starting point. Since the governor hasn't declared what the new program is going to be, the new executive orders will be after April 30th, we went off of the national framework that was established by the task force to reopen the country at the federal level. It was filled with a lot of information. It described 3 different phases, phase 1, 2, and 3, and it touched a little bit about what we're going through now. It's the precursor or the containment section of the virus before it started, before it got to the phases. So when the team met and they decided what it is that they wanted to focus on is, we can't plan forward until we realize where we've been and where we have made changes in the government to make sure that we've closed down according to the recommendations from the executive order. So when the team developed even further, they planned out which phases we are, and we'll show the chart in just a moment. You can't plan where you're going until you know where you've been. And there's many of the departments that actually were involved in closing the city down, and there was a systematic approach to that has to be considered in phase 1, 2, and 3 before you reopen the government. It's not as simple as flicking a switch and hoping that the rush of people will go back to normal. It's dangerous when that gets done. So what we did was a comprehensive approach to not a date event, it's a phased event, so that when the directors get to look at this model and they get to make the adjustments to their organization, they will look at the phase, what is allowed during those phases upon recommendations from the federal, the state governor, the state surgeon general, and the county emergency managers as to what is permissible during those periods as far as behavior. Going above that, releasing more, is not prudent at this time, and it's the best practice to follow the guidelines. But at least we can have a plan in place that we can build out for the next 2 weeks to 2 months to 6 months of what we're going to do in each phase as we move that phase forward. The good part about this program is if you need to move a phase forward or back, you've got the ability to do that according to what phase you might be in at that particular time. So the challenge is going to be, people want to know what phase they're in. They want to know what they're able to do. They want to know what the general population can get out and be involved with. But we also have to look at the vulnerable population that won't be able to get out and have the same experiences as the general population. And we're hoping that if they follow this plan in-house in the departments, they can make those assumptions at that executive level on how their employees are going to respond. For example, in phase 2, the governor might say, you can start opening restaurants and you can start and have people in there, but you can't have X amount of people per table or per foot. Our community development inspectors can actually go out and look at how many tables are present, and they can enforce the rules. But that's a plan that they can develop today before we even know when the phases start of what they're going to do in phase 2 or phase 3. They know by department what plan they'll have in place before we even get to that phase. So if we can get Tyler to go to the chart. The first phase is the containment phase. This is what we've been in. It was stop the spread, and that was prevalent in all of the documentation coming down from the state level. We implemented strict social distancing. We implemented workplace hygiene. We developed and support community programs, increased workers' monitoring, which changed drastically. We supported the quarantine and isolation needs, supported the widespread testing process, and we implemented wear masks and hand washing campaign. This is everything that we've done, and our documentation in the backup explains all the processes that we've taken from your executive orders on closing down the government to isolation to closing down things in the community to the specific things that we've done by department, from taking temperatures of employees coming into work, slowly shutting down segments of the government as we needed to and deemed fit, to the Parks Department when we actually had to close down because of the high concentration and density of the people that were showing up and going to these events. So containment and stop the spread is the segment that we're in right now. And before we can go to phase one, we're calling it guarded optimism. We have to go into the purple phase down below, which says move into phase one, which is very much driven from the government, the governor's orders. The stay-at-home order for non-vulnerable population has to be lifted. So the governor's going to come out with a new doctrine after April 30th, and he's going to explain exactly what he's expecting, and it has to hit that checkbox or that tumbler for it to open. Establish and acquire appropriate levels and types of PPE. We've all been struggling to make sure that we've got enough PPE to respond to calls, and if at some point when the call volume reaches a level plateau and the supply is sustained and we have a regular supply coming in, that's another tumbler that the governor is going to say that we can click and make that part of the next.
And I think that's important to note, again, when we mention the PPE, your first responders still have to, throughout this, and have been throughout this, just taking calls, the everyday call and responses. So that PPE equipment is essential. That is something you cannot go and respond to a scene without. And the limitations of getting it, we have to be mindful of that.
There's many areas. Now, we were never in the past putting patients on face masks for our protection, so that's an increase in volume of usage of PPE. We've changed our mask around that we're in a hardened face mask. A lot more money, but at least the crews have a higher level of protection. And if we don't have the basics of PPE and we do open up phase one, and we find that the call volume is going up or the COVID cases are rising, they might reconsider going back to the containment phase at that point, but that would be left up to the governor, the CDC, as well as the emergency management in each county. And then there's what the regulations are going to be looking for the 14-day flu-like and COVID-like illnesses. Are they going down? Are they leveling off? Our situation, as Bob Snyder indicated the other day, is unusual because we do have a limited amount of cases, and because we're testing more, we're starting to see more people that have COVID-like symptoms, and they're testing positive. Although that's not an indicator that we can't open up the community, it is an indicator that it's on the rise, but it's not as high as many other areas. So we're still in a safer trajectory, if you will, than in other areas like Jacksonville, Orlando, Miami, Fort Lauderdale. So just because we might be on the rise, the governor won't keep us from opening or keep us from going into phase one, but he will, keep an eye and be cautious about what we're doing and our behaviors as we move along. Once we go moving from phase one, and we enter into phase one, it's guarded optimism. That's still limiting the congregation of personnel and people in groups less than what I would assume be 10. Just because we're in phase one, they may not open it up to a higher number. We're going to continue to widespread workplace hygienes. This is going to be the new normal for us, probably forever. Making sure that the employees that show up have temperatures taken, regular hand sanitation, cleaning surfaces all the time. This is something that we're seriously considering in the fire department, not just because of the COVID, but for the simple flu or simple illnesses that we don't want people to come to work and have some sort of an illness and spread it to 2 other people on an engine company that will eventually get those people sick. And that's what we'll see as the future. Community programs as necessary, such as what you're working on right now with Rise Up and Feed Palm Coast. The social distancing, supporting community quarantine needs as needed, especially when you've got the vulnerable population of the older community, as well as those who are health compromised. And implementing any antibody test that may come down in the future. Today we've learned through the emergency manager that they're going from the swab test in the nasal cavity to a saliva test. That is a big deal because when you drive up in a car and you're given a tube and you're doing a saliva test, you can hand those out to multiple different people and at the same time while they're trying to fill the tube up and get more people through and completed in a shorter amount of time. And that's a tremendous increase in efficiency. and then continue to campaign for the use of hand washing and masks throughout the community. The Asia community has been doing this for years. Everybody looked at it as to why they're doing it, and now we're learning the hard way of we're going to have to get to this point and start doing more mask protection and protecting other people in the community from our own illnesses if we've got them. Okay, Tyler, can you move down? In order for us to go from phase 1 to phase 2, has to be a recommendation from the CDC and Department of Health on reports of potential viruses are under control. There has to be a downward decline, and then that would help move into the next phase. The stable healthcare system has to be in place. And right now, we don't have any surgeries that are going on that are elective. Everything is only emergency situations. When we start opening up in phase 2 and doing more elective surgeries, the hospital occupation for beds is going to go higher. And at that point, then we'll be able to reassess, is COVID coming in and causing more people to be occupying beds, and how many beds are going to be available throughout the state. Robust testing programs for at-risk health workers are going to continue, maintaining sufficient stock of appropriate PPE. And again, there's more people out doing things. That means more car accidents, more regular calls, more medical calls, more regular things that have been going on. They're going to start to take off again. And again, the Department of Health report for 14-day trajectories for flu-like and COVID systems will always be part of the assessment. It'll be a regular assessment to see if at any point they start to see a resurgence or a spike again. If all of those areas in purple are being met and they go to a phase 3, which would be the next gray area up, Tyler, then you'd have the, I'm sorry, go back to section, stage 3. Strategically reduce social distancing and maintain employee testing and maintain workplace hygiene and continue to prevention campaigns. This is going to be the critical area that the city has to take a hard look of what it is that we want the city to look like. I always used to say, when you pull off the interstate and you come up to the medians and they're manicured and it's beautiful, and you say to yourself, this is where I want to live. That's take a lot of work from the people that are working here to make this place look wonderful. But the future campaign might not be the beautification of the medians. It might be the health care that we provide here. It might lead into the nexus that we're going into with the medical clinical facilities that we've been working on. It just might be how the people are culturally changed to respect each other's distances and respect each other's health care, that they're just going to look at that as one of the aspects that we're going to sell the beauty of Palm Coast for. And phase 3 has got the most opportunity. It's got the most challenges. And we can go back to doing the same thing that we used to do back in January, or we can look at this as a cultural divide and change the way we've done things in the past and possibly look at our future.
I think, Matt, would you say, I know you've had your department heads look at these as well for the impacts on the city services. So to that point, again, because this is a marathon, not a sprint, we're anticipating the governor's order will lift and sort of guide us as far as the business reopenings, those sorts of things, and we're going to manage it appropriately and responsibly with our city specifically. But I think it's fair to say that our residents will see a difference as far as in the short term, right? As far as city services, meaning programming. Those areas that require a large amount of population in a certain amount of area, that's still going to be an area of concern, correct?
Absolutely, for a lot of reasons, and that's the wonderful thing, first of all, about these gating criteria, is they are applicable across departmental operations. Now, what PPE, when we talk about in phase 1 or moving into phase 1, what appropriate PPE might be for personal protective equipment, it's going to be a lot different for a council meeting, the situation where we are here now, where we have our masks, we have appropriate distancing and equipment, but in a scenario where we might be considering doing a children's summer camp program with 50 kids in a room, we might have distancing requirements that are not in force yet that we can't accommodate, and that level of PPE is going to be extraordinarily different. So, one of the things we're doing now is of course, with this exercise and everything, we're not sitting idly by, waiting for some date to get back to work. And so, Every day we've been using that information we collect, using the data we're getting from Palm Coast Connect, listening to our residents, and we're learning how to solve challenges and approach the operations we do a little differently. We're learning how to work just a little differently, still meet the demand, still provide the services to an extraordinary level, but achieving it a different way. I had a conversation with a department director who resides at Utility Drive, and 2 or 3 months ago I said, hey, maybe you should Zoom in for our twice-a-week meetings. And we tried it and just thought it was too weird. It just didn't work. After 2 months of Zooming, I can't imagine that, we would ever not have him just Zoom into our meetings. And so, we just gave a department level director 4 to 5 hours back in his work week for that he used to travel around the city. So we're taking these challenges, we're using them as real opportunities to evaluate, to respond better across the city. And I think, again, what will new normal look like? What will new practices look like? And that is part of this challenge of the unknown that we will continue to go through, again, respecting our residents and their desire for excellent and extraordinary services, their desire for interaction and communication with us, but how can we meet those challenges in new and exciting ways that are going to fulfill those needs? And that's been a focus area every day for every one of our department directors.
And so, Chief, as far as, we can't really snap our fingers and say no hurricanes this year. I mean, we've sustained 3, right, in the last 3 years. It's been an extraordinary time as a community. So when you take and apply this phased approach, I think it's also fair to say to our residents that it could change at any given time, not only because of the COVID-19 fluctuation of cases and hospital stays, but however, if you have an impact, a substantial impact in your department area, that you're responding now to another event, how do you balance all of that, and what decisions will be impacted with this?
The first thing is you don't throw all your resources at something immediately. You'll wear them out, they'll get tired, and they won't be able to effectively perform whatever the operation is. The long term is, if we can forecast that we're going to have so many hurricanes over a period of time, we know that right now our crews are strong, they're healthy, they're ready to go. But as we start to see things, you'll see that the tidal flow within the city government is going to change a bit. Right now, community service, customer service are all doing a lot more than the fire crews because the fire crews are responding. At some point, if we do have a hurricane, you'll see the fire department ramp up and take a more active role in running operations within the city, and that's just a natural transition that as the event comes up, we assess which department, which group is going to be at a higher level to handle the situation, and we go that direction. You cannot predict, and if you could, I'd like to know how. You cannot predict when we're going to get a hurricane and if we're going to get a hurricane, but we certainly can make a plan for the contingency in something like this, which is it's a large document. But what we can do is take a look at the health of the organization when we get to that point, and as we move forward, just plan out exactly what it is that needs to get done. And one of the things that the city manager and the department directors talk about is you don't bite the elephant all in one piece. You take small samples, and you give short destination goals, and you make those goals achievable. And if people that are doing the short goals and they achieve the goals, they'll feel better about what they have to do. If we put on the employees that we're probably going to get a hurricane and we should start working on it now, we're going to lose a lot of people from mental exhaustion. And we want to keep it in a checkpoint.
And I think that's, why this is so important, right? Because, it's allowed for other things to take place. So, in summation, I would say that, we can expect to our residents, we can expect the executive order by the governor to expire and not be, continued on April 30th. When that takes place, obviously, a lot of the restrictions will be lifted by executive order. However, we're asking our residents to stay aware, stay diligent with their social distancing, wearing the masks everywhere you go, and in those phases, again, if you are at risk, if you are compromised, immunosuppressed, I mean, those are the ones that we're really just stating, I think, in this phase. And that's reflective of the CDC, DOH orders, everything else, is we're asking for their safety to remain as indoors as possible, correct?
Correct. Anybody who's in a vulnerable position by age or by health, they should adhere to the guidelines. And as the governor does make the determination as to what the new path will be on May 1st, we'll address those in this document. The directors will take that information and make that part of their plan. And then as the plan moves forward and we get more information from Emergency Management and Centers for Disease Control, the Department of Health, the governor, and the federal level, we take that information and we apply it across the board to the city.
Great. Any closing statements for the residents to be aware of or to look for or to anticipate in the upcoming weeks?
Flexibility is going to be, it's got to be fluid. We're going to have some changes. We're going to want to get out, but we really have to follow the recommendations from the experts that are coming in, from the Surgeon Generals, from the governor, from the Emergency Management and the Department of Health. These folks have seen this in some form or another, although not to this extent, but their recommendations are coming from a high level, and it'd be prudent that we follow their lead.
So more to come. You know, our residents, thank you so much for your continued heeding the warnings, you know, participating in this. You know, we've said it before, we'll say it again, we are all in this together, and your behavior does depend on a lot of the outcomes that we will see throughout this process. And so look forward to continuing having conversations with you. Please continue social distancing. Please continue washing your hands. Please continue wearing masks everywhere you go. And we will get through this. Thank you so much.